So I ran a session where I presented my PhD findings, which looked at why patients delay reporting symptoms of neutropenic sepsis, which is a life-threatening side effect of chemotherapy. The reason that it's important is because patient-delayed reporting of neutropenic sepsis is related to poor relational care, and chemotherapy nurses could make a big difference if they were more holistic in their practice. So what we see are nurses who are very busy, focused on drug administration, and we need to use their nursing skills to support people more holistically and have better relationships with patients that help those patients manage and report their symptoms. So chemotherapy nurses are really important here because they're the ones who educate patients about their side effects at the beginning of treatment, and I think we need to do some training with them about how to conduct those consultations and move them from information giving sessions to being more interactive with patients, understanding their fears and worries and dealing with those worries and educating them properly about side effects to report, and using available tools that patients can access to help them report their symptoms. The research was driven by a concern both in my own practice around patient delays. So there's a huge concern that despite educating patients to report symptoms, many of them delay. And there's also some evidence in the literature, so other researchers have found that as well. So if we could only get patients to present earlier, it would be much better for the patients because we get on top of the symptoms earlier, and it would be cheaper for the health service because they wouldn't be as expensive to treat or as seriously ill. So a lot of the work I'm doing is helping nurses to be more holistic. So one of the ways we can help them to reflect on their practice is to conduct a monthly survey with the patients, and it's based on patient-reported outcome measures for chemotherapy nurses. So it includes things like incidence of side effects that nurses can help patients to manage. So 2 of those would be mucositis and nausea. So the patients are asked, have you got these symptoms? Have the nurses asked you about the symptoms? And they get asked questions like, did you feel treated as a person within the chemotherapy unit? Did the nurse ask you how you are? Or did you feel like you're in a factory? A lot of the evidence suggests that patients often feel like they're going through a factory and that it's quite impersonal in a way. So it's a very good way of helping nurses to reflect on their own practice and see how they can make a difference. So I ran a workshop with 2 of my colleagues, so Elaine Lennon and Liz Gifford, and it was a workshop focused on immunotherapies, which are a new treatment for cancer patients, and they have very individual and different side effects to chemotherapy. So the workshop was really about helping the audience to learn how to recognise and manage the side effects that are different to chemotherapy side effects, and I was coming from the patient symptom reporting perspective, so just explaining to these nurses why people delay presenting with symptoms and how they can make a difference and help patients to present earlier. So a lot of that is around empowering patients, so it's how you engage with them so that they don't become passive, which is one reason people don't report their symptoms.